Are robots a good thing? A lot of people think that robots can be scary and mysterious.
You kind of think of robots about how like the kind of evil things or something like from the Terminator.
Like a toy, but if somebody programs it the wrong way, it could be evil.
Pepper is a robot that is designed for use in healthcare, especially to help with the demands of an ageing population. It is a humanoid, which means that it looks sort of like a human. We wanted to find out what people think about using Pepper in care settings, so we asked a group of people at a church in South Manchester how Pepper makes them feel.
I think your interest and curiosity are aroused, but they're not stirred or agitated, they're immediately mollified, so that it brings out your softer side, not your aggressive side. You don't feel at all defensive. And so your attitude towards it is basically a gentle, accepting one.
The fact that the hands are so well differentiated, you feel as though you could get hold of the hand and do something with it. It also reminds me of a mermaid. That has a nice feel. So I would feel that perhaps if I had more to do with Pepper, that I would be attracted to her because of these attributes.
Yes, I think the more sophisticated a robot, the more threatening it can be. And Pepper is a sophisticated robot that's designed in such a way as to minimise that threat.
How does this affect what people think about the idea of robots like Pepper caring for elderly people?
Let's imagine an elderly person in a home and they've got a robot. So for instance, we can say that AI should preserve human dignity. And in the case of the robot that's fetching and carrying, help this person stay in their home, we can say, well, this is good, this is helping preserve their dignity. And probably their autonomy too, they want to stay in their home. But then we have this other, is it causing social isolation at the same time? And so understanding what could happen and how you mitigate that, or maybe how you give people the choices and awareness of the risks, is something I think is really not well understood.
But I can't imagine that someone who's unable to walk about and do things, that is sitting in a chair most of the day, would get the same kind of reassurance from listening to a robot rather than listening to a person. Just saying, would you like me to make you a sandwich? It's the human. Or telling you what the neighbours are doing. Yes. I find that, I think that would be rather a distressing situation.
It'd be all right in a care home or a community, but if it's in your own home and you've got one of those, that's the only contact you'll have, and you won't have any human contact. So you lose out, don't you?
If I was to end up in a care home, it could well be there'd be a robot bringing around my pills and tablets. It's already here, and people get quite attached to them.
So the patient responses to the robotic platform that we take to them are surprisingly very good. So we are all very used to the idea that old people would never like technology, will never use technology, will never understand technology. But then when we actually bring robots in care homes or shelter facilities, when we introduce them to the population that needs to use them, they are actually very welcome. And it could be because these people are fundamentally lonely sometimes. So just having something else that can talk to you or interact with you brings some sort of reassurance, and is also a novelty, of course. But it's definitely promising for our research to actually see that the technology is needed and is viewed positively by most of the patients.
Eventually, you will be able to have a conversation with the robot, because it'll be programmed. Everything will be programmed in, and you'll be able to say, "How are you today?" And it'll say, "I'm fine. How are you?" And that's surely better than sitting on your own and worrying about them not turning up.
Yeah,
Yeah.
The most interesting reaction I've seen with Pepper was actually with an old woman. Basically, we were in this event, and I was like, speaking with other people. When I turned around, I noticed that this woman was just like stroking the robot on its head, and it was like whispering to it, speaking to it like if it was like, I don't know, a young child or something like this. And this actually made me think that whatever the efforts that we put in trying to model how these robots insert themselves in our societies and everything like this, I think that these artificial social beings just slot in, following our natural needs and beliefs and desires.
Well, what you'd hope for is the kind of care that I gave my mum, which is 24/7. But what we know we're going to get is probably 20 minutes 3 times a day.
Yes.
When it comes to robot care though, there's another side to the story.
I'm sort of concerned about the robotisation of humans. We live in a sort of a world of targets and automation, and we sort of take that for granted. And I do wonder if we're sort of meeting the robots halfway.
The healthcare system is really demanding, and because of that there's a real risk that the emotional side of nursing can be neglected. We do know that nurses very often only feel they have time to focus on the tasks, so the doing of the doing rather than making those therapeutic connections, using their emotions, showing that empathy. Nursing is not only a science, it's also an art. So there is some evidence to support the use of empathy in terms of healing. So we know that people who are unwell heal more quickly when the nurse shows empathy. We know that patients are more likely to stick to a treatment plan if the nurse has been sitting with that patient and they spend time understanding their perspective and their lifestyle. The treatment plan is then more likely to succeed because the patient has been involved in it, they understand it, it fits in with them. So in that way, empathy, emotional empathy, is really important.
We have such diverse needs. There are physical needs, there are moral needs, there are spiritual needs, emotional needs, and the question then is, how far are robots or computers able to meet these so far?
So if you ask me if robots could care for us, the first thing I'd say is there's two uses of the word care here, right? So there is physical caring, and so that's a question of, can a robot help me get up, help me get dressed, wash me? Now at the moment, we haven't quite solved the mechanical issues that would be involved in having a robot physically care for us. But I think we more or less see how that could be done. So I think there's a feeling that that's close. But obviously there's then this sense of caring in that you have some kind of emotional state, a genuine sense of connection. It's kind of ironic in a way that I can just imagine quite soon having a replacement, at least for the diagnosis end, that we spend years training doctors to do. Whereas I'm not sure we necessarily are going to have a replacement for the person who's on little more than minimum wage, who will come in and lift you out of your bed in the morning, you know.
Nurses are not going to be completely replaced. They're always going to be there, but probably they won't have to, spend that much time for each patient. Maybe they're going to be able to account for more people at the same time, and they're always going to have interactions with humans and talk with them and everything, but maybe the most part of the day would be occupied by robots.
So I think that robots could not really replace carers right now because of how these machines are built and what this machine can do. It's very hard for them to completely take over the roles of a human carer because of all the emotional side that the humans have, the machine cannot really have right now. And also because these tools are built for one purpose only at a time, while a human carer can take over different tasks and is able to learn how to do different things, even if it's not pre-programmed to do it. machine cannot. So these tools, for example, this robot, he's a companion robot, but his hands are not useful for anything, and he cannot help in lifting a patient, he cannot help in cleaning rooms or the patient itself. So it's not as versatile as a human, and that's why I think it's a bit too biased by news and science fiction, the idea of robots taking over.
I would be very happy if there was a way in which robots could behave as a direct descendant of the, the sort of the Neolithic axe, that it was a tool and the tools have been developed from the very primitive flints. And I would like to see a world where robots can be developed to do even more things, but not for robots to replace the human contact.
How we think about robots in care then is really complicated, and there's no straightforward answer to the question of whether they're a good or bad thing.
It's got a tremendous potential. It's got a tremendous potential for good, but what are the implications of this for jobs? What are the implications for care?
So my personal opinion is that robots open up lots of opportunities. It's amazing how in the last few years we've used technology in so many different ways to support people in living healthily. So I'm really excited about a future with robots in and how they might support us to deliver healthcare effectively. As nurses, we care for a very diverse population. So in order to do that, we need a diverse population of nurses too. So for me, having robots in that diverse population, I would see as maybe complementing the care that nurses provide. I wouldn't see them necessarily as a replacement, but I think that they could be part of the healthcare team.
The first positive aspect of robotic care is that of being a help not only to the patient, but also to the care and the worker. I think that the biggest limit of robotic care is the multitasking that I mentioned before. So we can promote a robot to do one task, but then it will fail the expectations of the patient in actually learning a new thing or doing a different task that it was pre-programmed to do. So I think that that's the most problematic part right now.
So what do you think about robots like Pepper delivering different aspects of care? Do robots like Pepper change how we think about and value human care?
It sparks lots of questions, and I haven't got any answers, but it raises lots of questions.